I'm Dr. Barry Eppley, plastic surgeon of Indianapolis, and I wanted to spend a few minutes with you talking about a very popular procedure but often misunderstood operation, that of what we call in plastic surgery a limited facelift. Now, the limited facelift, from the public's perspective as well as from marketing, goes by a lot of different names. You may know it as the lifestyle lift, a mini facelift, the quick lift, the swift lift, the S lift, and a whole variety of other names, and many times surgeons will often put their own names on that type of procedure. But they really are all the same type of operation, and that is what I prefer to call the limited or mini facelift. Understanding this operation is based upon understanding, first of all, what an actual full facelift really is. A facelift I have found to be very confusing for many people, as they interpret it as a big operation that goes from basically the top of your head down to your neck, when in fact a facelift is really best known as a neck jowl lift, because all it is going to affect is the jowl and the neck area. It does nothing from the chin northward. So it is a neck jowl lift, and it is a very powerful procedure and is really most appropriate when one's problem is significantly in the neck area with a double chin, a neck waddle, and a variety of extra tissue in the neck area to get back to that very sharp neck contour. A limited facelift compared to a full facelift is just exactly that. A limited facelift is really particularly a jowl lift. And unlike a full facelift where the incisions go in front of the ear and then up and around the back of the ear, in a limited facelift the incision is just in the front of the ear, and to be more accurate, it really goes inside the front of the ear and then back and stops at the bottom of the earlobe. From this approach, a more limited lift can be done with particular emphasis on improving the jowl area, and there is a little bit improvement in the neck area. This limited facelift, or jowl lift if you will, is particularly good in my practice for two types of patients. The first patient that's really best for is what I would say is the younger patient, the patient that may be in their early 40s to perhaps as old as 50. In this type of patient, they usually don't have a big neck problem. Their problem is just the beginning of some sagging jowls and a little loose tissue in the neck. And you can see in this type of patient the limited facelift is absolutely excellent because it is going to tuck up that area and do a really nice job. Therefore, it really is what I call matching the operation to the problem, and that is why it is good for that type of patient. And you can add a lot of other more minor procedures with it, eyes and skin resurfacing and so forth, that really help the overall result. The second patient that it's good for is really the older patient who really has a bigger neck problem and quite frankly would be much better off with a full facelift, but they simply do not want to undergo that and they are looking for a smaller procedure. This operation doesn't necessarily match their problem, but they will get some improvement without a whole lot of investment of recovery. So that's the second type of patient that it's good for. I think the limited facelift in general is just as it's advertised. Really, within a week you look pretty good. After the surgery takes about an hour, hour and a half. It could be done under sedation or general anesthesia. There really are no dressings and drains or sutures to remove afterwards. You do have a little bit of swelling and bruising, particularly in the side of the face and the jowl area, but in a week you really do look pretty good. So the key to a successful limited facelift result is really choosing the right type of patient and matching the right type of expectation. I hope this information has been helpful, and I wish you the best of luck on your facelift experience. I'm Dr. Barry Eppley, plastic surgeon of Indianapolis.